There exist certain signs and symptoms within the female body that might be indicative of the precise moment of ovulation and consequently the fertile window. They would be as follows. Alterations in the vaginal discharge. The volume increases, the consistency changes, and it becomes clearer. It grows more elastic in order to permit the passage of the spermatozoa through the uterine neck. This is due to the increase of estrogen in the body. Changes in the cervix. It is positioned higher with a softer consistency and a more open orifice. This is how spermatozoa can enter. Pain. Discomfort or sharp pains in the lower abdomen area when the ovarian follicle ruptures occurs. Increase in libido. The woman may notice an increase in sexual desire due to the rise in estrogen. Breast tenderness. It's possible that the breasts are more sensitive and there is greater breast tenderness. Changes in your mood. Some women begin to notice emotional changes due to the hormonal shifts occurring. Spotting or some light vaginal bleed. It is not always produced, but certain women have this slight vaginal spotting that coincides exactly with the time of their ovulation. Temperature changes. Following ovulation, there is an elevation in temperature ranging from 0.2 to 0.5 degrees Celsius. This is due to the increase in progesterone after the release of the egg and the formation of the corpus luteum. Normally, many of these signs of ovulation go unnoticed by the woman, but they could be detected by paying a little attention to our body. However, it should be noted that not all women are just the same, which means that not all women will have the same symptoms when they are ovulating.